Career and specialty choice. One of the most challenging tasks that must be successfully completed by the conclusion of medical school is to choose a specialty area. There are a variety of opportunities available to students that impact their career, including specialty choice, practice setting, and the particular area of focus they will have. A number of factors influence specialty choice, including personal interests, the personality of the specialty, the types of patients, colleagues, and conditions seen by different specialties, lifestyle considerations, personal experiences within a specialty on clinical rotations, other medical school experience, and debt level. An important factor to consider when selecting a specialty and a practice setting is what you find most meaningful about your work. Studies in physicians suggest that having meaning in work is one of the most critical elements to long-term professional satisfaction. This brings us to the concept of flow. This construct suggests that individuals preferentially cultivate a limited number of activities, values, and personal interests. And when you get the optimal mix of these dimensions for personal satisfaction, you enter a state of flow, characterized by deep concentration, intrinsic motivation. In a sense, you are facing high challenge, but that you have the skills to meet this challenge. An example of flow is to consider an individual whose personal hobby is painting. On Saturday morning, they enter the garage, take out their easel, listen to their music, and begin to paint. When they look up, several hours have passed because they were so engrossed in what they were doing and enjoying it so thoroughly. That's an example of being in a state of flow. Graphically, flow can be summarized in the picture shown here, with challenges on the y-axis and skills on the x-axis. Consider an individual on the first day of their surgical internship trying to take out a gallbladder. This individual has limited skills because they have not done this before, and this is viewed as a large challenge. Thus, it is likely to promote anxiety. If you turn the clock forward 10 years, this same individual has now acquired an excessive amount of skill. They have done this task many times before, and it will likely be viewed as a low challenge, and thus precipitate boredom. Consider that this is the same individual performing the same task, and at two different time points it could result in anxiety or boredom, and at some point in between likely resulted in a state of flow. This illustrates how interests change and point to the need to reinvent yourself throughout the course of your career. An important step in considering your specialty choice is to identify personal values. What matters to you most in life? What is the optimal balance you wish to have between personal and professional life? And avoiding taking on a mentality of delayed gratification. From a professional lens, you want to consider what aspect of work you find most meaningful, what things you would like to achieve over the course of your career, and what it is that motivates you. Common themes for physicians include being a healer, being an expert, being a teacher, building a successful practice, and making scientific discoveries. There are a variety of strategies that can be used to identify values, including a number of reflection questions, discussions with those who know you well, and worksheets. As noted, it's important to recognize that interests change and to have the courage to move into new areas if what previously excited you has lost its meaning. It's important to choose your specialty for the right reasons, and this cannot be based on only a personal or professional consideration, but needs to be a sphere of medicine that allows you to achieve both personal and professional goals. Once you choose your specialty, expose yourself to different practice settings and sample different areas of focus. Attempt to find a setting and focus that allow you to find both professional meaning and empower you to achieve your personal life goals. I encourage you to explore the other sections on the resource page pertaining to career and specialty choice. This includes phone numbers for local resources at your center, including support staff who may be able to meet with you individually regarding career counseling. In addition, you will find national resources linking to the AAMC Career in Medicine resource, as well as the Medical Specialty Aptitude Test that can give you a list of specialty areas that may best fit your personality and interests. Other activities and links to key publications are provided.